With everything that's been going on lately, um, I haven't had a chance to come back and update you on the ketamine infusion treatment that I started recently. And now it's on pause. So I'm going to tell you all about it. And if you don't know what I'm talking about, let's make sure you go back to the previous two videos that I made about this topic. And if you also want to know more about the everything that's been going on that I just mentioned, also go back and watch the other videos that I made on the topic. It's been a lot. So I've done two ketamine infusion treatment sessions so far, and I'm not gonna have another one until the new year. Not sure yet. Not sure um, when yet. It's hard to say a sentence. Not sure when yet. We're still trying to figure it out. And I'll explain to you why I don't know yet. But let me tell you first what happened during that second session. So the first one, I slept reportedly like a baby. I don't remember. I just know the sleep was good. And when I woke up, I was good. Um, and so I was grateful, really grateful for that because that propofol sleep, sweet, 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 sweet. So I actually was looking forward to getting another good sleep at the clinic when I went to the shots. The first time, the main issue that I had was my left arm that had been pretty badly, hurt when the nurse was trying to find the vein. Even though I told her this is not gonna happen if you try to put it like in the elbow crease, it's not gonna work on that side. She insisted. She tried to do it, but go back to the video and you know what happened. So anyway, I dealt with the pain for a few days, so that was annoying. I was very tired the day after, and I felt some dizziness, little bit. I think it was more so the exhaustion, but I don't know if it was due to the treatment because again, first session they don't give you much medication, so the mix is ketamine and propofol. But because you're just getting started, they don't give you a dosage where you should feel any um, actual like bad side effects or even no any benefits either. So it's just to get you started. But I felt exhausted, but I think also I was just exhausted in general. So that might have been what it was. So the main issue was the pain in my arm. So second session was a week after the first one. And the first one was on a Saturday and the infusion was early in the afternoon. So I spent basically the entire afternoon there because I got home around like 6 p.m. or something like that. Um, the second one was on Sunday and it was early morning, 9:30. And so I got home early afternoon. And as I said, it was very different. Um, no problem with my arm this time because I reminded the nurse she was actually going to do it again at the same spot that the first time, and I had to tell her, no, 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 hand, please, hand. So she did in the hand, so no problem. But the the chair, first of all, so the first time I was on the table, like the regular table where if you go to the doctor or if you go to like a clinic or something, this is the same type of table that I'm talking about, and it's very underrated how comfortable those tables are. I mean, for me, and when I go to the clinic on Thursdays for my injections, I'm lying down on my stomach and I have a pillow around like my stomach area because of my back issue, right? But that position and being on that table, the table is just like the perfect level of firmness, and I could just stay there. And so, give me that plus propofol, and this is not an ad for propofol sleep. But I'm telling you, when you don't sleep, when you're in pain all the time, when you've been going through as much as I've been going through these days, and all you want is some peace, quiet, and just not care about anything, forget about anything actually and not feel anything, this is the best combo. So that's what happened the first session. So, but the second one, they actually put me in like one of those reclining chairs, and I thought it was going to be awesome because I've always heard that reclining chairs are awesome, like the Lazy Boy one. You know, I don't know if I've actually tried one before, but I always thought that from what I've seen and what I've heard that they were great. So I was in one of those. The problem was that the nurse needed to know how to properly set it up. So she was making me, um, use it like manually, change the uh, what you call that? The position. Whew, change the position manually. And so that's what I did. So we pushed the area, like the part of the chair that supports your legs and then the parts that supports your head and just like being in the lying position. So at first, all good. I'm lying down, but then all of a sudden the leg, the part that supports my legs starts popping back up. And same thing with the part that's supporting my head. And I kept having to push them back down with my legs and my head. So not comfortable at all. I don't recommend. So the entire time I've had to do that. Every single time I would slightly move, or maybe there was not as much pressure on like on my legs, or like my head wasn't putting as much pressure on the chair, it would just like start doing that. And then I would have to bring, so it was terrible. Absolutely terrible. And especially when you're trying to relax and the whole point, like, you're going to be there for hours, it was just bad. All that to realize at the end of the session, once I was like gathering my stuff and ready to leave with my friend and neighbor who came to pick me up, that was actually not a manual chair. And there was a remote that was like stuck on the side of it. That's how you're supposed to actually control and make sure that everything stays in position. So a complete fail, absolute fail. So that was one, and that followed me the following week, like the that was on a Sunday. So like then after that, Monday, Tuesday, Wednesday, uh, Thursday, I was still sore from all that. That it was just not good. And then the main thing was I didn't sleep. I did not sleep. I mean, I like nodded off on and off, but I was mostly hallucinating like the whole time. I could see myself. And this is a very strange feeling, like what they call an out of body experience, when you're seeing yourself doing things and you're not actually sure that you're doing those things. You don't know which one is you, the one who's looking or the one who's actually doing the things. Very weird. So I'm floating in the room basically. And mind you, this time I'm in the room. Initially, it was just the nurse and myself. And then there was another patient who came. I don't know when he arrived. But I remember that when he entered the room, I couldn't tell what he looked like. All I could tell was that there was like a giant, I don't know how to describe it, like a big giant ball of curls, dark curls. And it was like a mushroom because I could see like the foot the foot of the mushroom, and then like the big, um and but it was moving, right? And I could tell it was a person because the person was talking. And I remember asking, do you have curls? And laughing. And he said, yeah. And he laughed too because he was probably thinking, what is she talking about? Of course I have. Can't you see my curls? But I couldn't see his face. I couldn't see anything about him, like what he looked like, what's like how tall he was, like how old he was, anything. Just the curls, like big. So then he sat, and that was his first time. And he was asking questions to the nurse. And I remember trying to, I was already under, and um, I remember trying to communicate because I wasn't asleep. I was trying to communicate, but none of the things that I actually wanted to say would come out. And sometimes something would come out, but it would be something that didn't really make sense, or maybe it did, I don't know. But then I would be laughing also. I remember that part. Um, so that was very, very strange. And then he fell asleep like a baby. He was snoring too. I could tell the sleep was good. It's like, I mean, he was comfortable. And when he woke up, um, he was like, "Oh, whoa, what was that? Did I sleep the whole time?" You know. But me, like, I felt trapped in my body, not being able to communicate with anything. At some point, I started feeling nauseous, and I couldn't even tell the nurse or the doctor when I saw him passing. I couldn't say anything. I think I tried to put my hand like in this area to show that I was feeling something, but I don't know that, anything was communicated, that they even saw it. So this is a weird, very weird thing to go through, and I do not recommend. I really do not recommend. Um, Turns out, so after it was all done and I was having a conversation with the doctor before he let me go home, he told me that it was because I didn't get enough propofol. So next time they will increase because they had already increased the ketamine and the propofol compared to what they gave me the first time. But then he said, so that means whenever we increase the ketamine, we need to increase the propofol even more, because it sounds like you need more of the propofol so that you don't have the the um, the hallucinations, and that you can actually sleep. So for next time, this is the plan: increasing the ketamine and then increasing the propofol even more. And then I told him about the nausea, and the dizziness was also of the chains, because when I um, after I was kind of more lucid, once the treatment was over. I apologize for the sound. I don't know if you can hear it. Sirens, life in the city, and my window is open. Um, so when I was done and just recovering, I went to the bathroom, because yet again I could not just go on myself, because now I was awake. And even though the night before I practiced, and I made a short about it, I don't know if you guys saw it. I practiced at home, and I actually did it standing, which is a weird thing because I don't pee in this, like, while standing usually. But this was the only way I could actually practice without the fear of messing up my furniture, or, like, my couch, or my bed, if it spilled out of the diaper. So I practice standing, because if it spilled and it started like leaking, it would leak on the floor, and I can clean it pretty easily. So I managed to do that. But then once I was at the clinic, and then the treatment ended and I was recovering, I could have actually gone on myself. But again, there's psychological blockage was still there, so I just couldn't. So then I was like, no, I'm just gonna get up and then go to the bathroom. But the dizziness was on a different level, so I had to actually hold on to, like, the walls of the like, in the hallway leading. Thankfully it wasn't far, and I knew my way, but it was really, like, intense. And the other patient was dealing with that as well. Um, so those are, like, the main thing that happened. After I got home, I was still feeling dizzy. I still had a headache. So to go back to, like, the conversation that I had with the doctor, so he said more ketamine next time, and then even more propofol, but also we're going to give you something for the headache and something for the nausea during, so that you don't experience those things. Um, you'll still probably have some dizziness afterwards, because that's what happens to a lot of people. And so, yeah, so that's where we at. So then I go home. I'm still feeling dizzy for a few hours, feeling very tired. Also, I didn't sleep, so that wasn't helpful. Um, and that continued. Uh, the rest of the day and into Monday. Um, so I rested, and also like the worst part was really like the soreness from the uh, the bad experience on the reclining chair. So this is what happened after session 2. So now, why haven't have I not had another session since? Even though I think I mentioned at the very beginning of the series was that the plan was to do 6 sessions and before the year ends, and then start again in January and have a new set of six sessions that are covered by the government. But actually, it turned out that the way they count the 6 sessions that are covered is not it's not from January to December. It's from the moment that you start. So I started in November. So that means that if I finish the session before the end of December, then I have to wait until next November to get another set of 6. So we have to pace them. So I only have 6. I only already done 2. So I have to save the 4 to carry me until next November if I want to actually finish the cycle and find out if it works, which is a very frustrating part. So I'm going to go on a little bit of a rant now because I find it so frustrating that this is a treatment that can actually make a difference, and it's making a difference in in the lives of a lot of people. More sirens outside, I apologize. It's a treatment that makes a difference in the lives of a lot of people that I've heard, that I've seen, and it could make a difference in my life too. But in order to find out, I have to get to that threshold after the 6 or 7 session where I've been given a high enough dose of the ketamine, the mixed ketamine and propofol, to find out if I actually get some benefits for the pain and maybe also for the mood, because that's what it does in the beginning, and then it's more so for the pain. And then once you know exactly what dosage you need and what type of benefits you get, what type of side effects you get, then you can start now planning ahead and scheduling how you're going to get your next set of sessions, and if it's worth continuing, right? But if it's worth continuing, you want to be able to have access to as many as you need, not as many as you can afford. And that's the part that's like, I mean, nobody should have to be deprived of a treatment because they cannot afford it. If I had a job right now with great benefits and part of the and the private insurance that I had, or if I had even if I wasn't working, but if I had like a private insurance and they could cover the treatment, I could continue and have as many sessions as I could afford, like as many as the insurance company would cover for me. Or if I have unlimited funds or like a lot of funds, I could pay for those things myself and just have the treatments that I need, not just the ones that I can afford. And right now, I cannot have any of those. Only the ones that are covered, and I have to wait and for like I have to pace them to pace myself and to like space them out in time because I cannot afford to have more. And it doesn't make sense. It doesn't make sense, but that's the reality now. So I don't know when I'm going to have the next one. More sirens. I don't know what's going on right now. Whew. But that's what it is. And it's just, I just don't get it. So maybe they'll change. Maybe they'll decide that, okay, we're going to give you more. Maybe it won't work for me. But when I'm talking about those things, I'm not only thinking about myself. There are people who already know that this treatment works for them and that they need more. Some people are okay with like the 6 sessions per year because maybe that's all they need. But other people, maybe they need more, but they cannot afford to have more. So they in between, they do other things. I have my injections. So even if I only had the six sessions per year, in between, I can have the shots if I need them. And I can also take medications like in between. But the whole point, and for me, especially, is like I'm not trying to get more treatments. It's been already a lot. Like having to go back on medications recently, as much as I have, has been very difficult because I've mentioned it to you before. I've been through a time where I was taking 25 pills a day, and it took me forever to be able to stop. It was necessary at the time, and I'm grateful that I did. But I was very happy when I was able to stop, and I was able to manage my pain and my all my different conditions without as many, uh, you know, medications as I used to have, right? But I also understand that it's not the reality for everyone, and also I probably should be taking more because that was the whole point of my family doctor telling me that he would feel more comfortable if I at least allowed him to prescribe the painkiller and the sleep medication in case I need them. I don't need to use them all the time, but if there are times where I need them, knowing that I have them at home would make him feel better and would give me the choice to decide in that moment if I want to, because I'm always going to err on the side of no, I think I can still do it without like me. But lately I've really had to take them, and I'm grateful that I listened, that I allowed myself to get to say yes, and to get the prescription and to have them at home because I've been needing them. And I wouldn't be able to sleep at all and get any peace at all if that didn't happen, this past summer. And my doctor insisted on me starting to, getting the prescription back. So all that to say, I'm not trying to take more medication and all that, but there are treatments that are really making a difference in the lives of a lot of people and in my life as well. And we should be able to get them if we need them, regardless of the money that we have or don't have in our bank account, or whether we have a job or we don't have a job. Because sometimes you have a job with the great benefits, but because you have to work, you're not able to actually follow up with the treatments that you have, because the two don't always work together. This is such a there's an aspect of being disabled, chronically ill, dealing with like a lot of chronic conditions, and having to constantly navigate those systems that absolutely drains people like me, because we have to take those things into consideration. We have to fight all the time. And I'm grateful that I'm not alone, because my team of doctors, you know, starting with Dr. Henry, really care about me and really do everything that they can to protect me and to make sure that I have the best of everything. But they can only do so much. Our governments have to do more, and we have to demand more too. And the people who don't have those problems and who don't know those realities, you have to be with us to fight those things, because we're not going to be able to make a difference if only we talk about those things, because they don't listen to us, not enough. And if they do, then they just don't act on it. There's always more. There are always more pressing priorities that don't include us. And it's literally killing some of us. So yeah, right now, no ketamine treatment. I'm gonna go through the holiday season, and I'm going to take care of myself in other ways. I'm really doing my best. But I will continue to keep you posted, and I appreciate you indulging that rant and watching till the end if you stayed. I really enjoy making those videos and talking to you and updating you on things that are going on. I love to have fun too, as you know, and I hope I can do more of that. But I really want to thank everyone for tuning in every time, watching my videos and sharing them, and liking and commenting and everything, interacting with me. I really appreciate it. Thank you. This journey has been awesome, and I'm really grateful. And I will see you in the next one. Bye bye.